Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
This is Dr. Angela, everyone's favorite OBGYN, and I would like to welcome you to episode 5 of the Ask Dr. Angela podcast, where we discuss everything from fashion, family, politics, and a sprinkling of medicine to top it off. I keep it light, I keep it fun, I keep it very simple. Before we dive into things, I'd like to thank you, the listener, for taking time out of your busy schedule to listen and join us this evening. Today's question comes to us from Liz.
Hello, Angela. It is Liz. I need your advice on how to help with hot flashes. Girl, it's killing me. Help. See you soon.
First of all, Liz, thank you so much for submitting your question, and it's a fantastic question. I get asked about hot flashes all the time. I mean, if it sounds like I'm kind of exaggerating, I promise I am not. I feel like every other patient that I see is either perimenopausal or they're menopausal, and the symptom that they have most often and the one that annoys them the most are these hot flashes. I mean, I feel sorry for the spouses of these people who oftentimes are, freezing and feeling like they're sleeping in an icebox because their partner or significant other is suffering from these hot flashes. So, Liz, with regards to dealing with hot flashes, everyone's going to tell you the conservative stuff first. Wear layers, dress in layers, put ice or cool cloth and rag on your forehead, on your neck, sleep with the fans on, sleep with the air conditioning on, it's just a lot. With regards to medicinal things that you can use to treat hot flashes, they're all over the place. Certainly if you are a more natural type of person, you can try things like soy, yam extract, black cohosh. Actually, black cohosh is the one of all the natural remedies that are out there for dealing with hot flashes. Black cohosh is probably the most popular one amongst my patient population. And certainly, there's always hormone replacement therapy. Estrogen solely if you do not have a uterus, and estrogen and progesterone if you still do have your uterus. Certainly, hormone replacement therapy is not a long-term fix. Most of the time, we don't leave patients on it for more than 5 years at a time, but it is certainly indicated in treating menopausal symptoms, i.e. hot flashes. Another line of medications that we sometimes use to treat hot flashes are SSRIs or SNRIs, and these are going to be medications that are more commonly known to you for treating things like depression, anxiety. Effexor, which is an SNRI, and that stands for selective norepinephrine reuptake inhibitor, is a common medication in this category that is used to treat hot flashes. Using medications that belong to these categories of meds is sometimes a nice option for folks that have a contraindication to being on hormone replacement therapy. So, Liz, in short, and I know that was not short because I've been rambling, and anyone that knows me knows that I always have a lot to say, but you've got a lot of options to deal with your hot flashes. So I would recommend making an appointment with your OBGYN and discussing some of these options and seeing which one is going to be in your best interest. I'm hoping that helped just a little bit. Liz, thank you so much for taking the time to submit your question. For those of you that are listening, if you have a question that you would like featured on the show, please go to askdrangela.com. That's askdrangela.com. You can go and ask your question right on the page by clicking on the microphone on the right-hand side. If we use it, we will send you an official Ask Dr. Angela t-shirt. Liz, because we did use your question on today's show, my assistant will be contacting you and we will be sending you one of our bomb-ass t-shirts. In closing, a quote from Mahatma Gandhi. It states, "First they ignore you, then they laugh at you, then they fight you, then you win." Until next time, look better, feel better, be better. I'm looking forward to reconnecting with you in the next episode of Ask Dr. Angela. Have a great evening.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.